George Kilpatrick Inspiration for the Nation, celebrating people we feel good about. Denise Baker is the Director of Quality Improvement and a nurse at Syracuse Community Health, one of our partners. And Denise is here to talk to us about Breast Cancer Awareness Month. Denise, you've got some work to do here because we want to make sure that our audience knows that there is support and help for them to make sure that they are screened properly and get the information that they need. So, what do we need to know?
Oh, thank you very much. It's a pleasure to be here and to assist with bringing awareness to breast cancer and how we can minimize the impact on our community. So, as you mentioned earlier, statistics um, state that 1 in 8 women in general will be impacted by breast cancer. There is a staggering percentage of 41% of Black women will die of breast cancer. And that's largely to not seeking preventative care and screening prior to finding breast cancer. So, in other words, what's happening is that it's found breast cancer is identified late, and the prognosis is more dire at that particular time. So what we have to do is reach and teach everyone, teach one, and hopefully we will improve those stats significantly. Um, One of the things that we could do in regards to that is early detection. Women ages 40 to 49 should really have that discussion, if they haven't already, with their provider as to whether or not they should receive a mammography and talk about their background regarding breast cancer. If they have any family members, interestingly enough, there's only a 5 to 10% hereditary rate associated with breast cancer. So that means that we have a lot of preventative metrics that are preventative tasks that we can put in place to help avoid um, breast cancer.
So let's talk about that. So, what are the things that we can do to make sure that people know that they can get the support? I guess one thing we would say is you got to know your breasts, right? You got to know
Right.
So let's talk about that.
Absolutely. So every month, schedule, you should really be examining your breast. From the time that you begin your menstruations, you should be checking for any signs or any variations in your breast. You look for abnormalities such as a lump or a bump, any puckering or pimpling of the skin. Um, any of those should be discussed with your provider. Not every lump or bump or variation in your breast is um, an indicator of cancer. However, it is something that needs to be looked at. If you have some discharge should be evaluated again by your provider. The likelihood, the likelihood of having cancer younger than the age of 25 is not um, significant. It's a low chance of you having breast cancer. The average woman identified as having breast cancer is 58, approximately in that 58 age
Mm-hmm.
range. But just because you're younger than that does not mean that you shouldn't be checking your breast regularly. You should be receiving a mammogram regularly, usually every other year after the age of 50. But that is really a discussion that you have with the doctor as to whether or not you'll receive it yearly or every other year.
What about risk assessments? Is that something that you are seeing women experience where they see? I guess there's some sort of a genetic screening. How common is that?
Well, yes. I mean, that having if you have a family history of breast cancer, then you definitely want to make sure that you speak to your provider and identify the risk factors. If you have a parent or a sister or a close relative that has been impacted by breast cancer, it is quite usual for them to test all the women in close proximity. So that is not the number one tool that we utilize, though. Self-awareness, decreasing any alcohol consumption, managing your diet, maintaining a normal BMI, um, including high nutrition in your diet is important. I'm not sure, did I mention smoking? If you're smoking, then do what you can to quit. That's not something that happens overnight, but seek some additional assistance so that um, you can decrease the chances of any breast cancer related illnesses.
You mentioned BMI, or body mass index over a certain level, which would indicate obesity, I guess, is the term that they use. Is that a factor?
Yes, obesity is a factor in breast cancer, um, and that's why diet and exercise is important. If one of the other criteria is if you've had children and you don't breastfeed, that puts you at an increased risk.
Hmm.
Early, um, I'm sorry, when you early menopause is a risk factor as well. And again, your doctor can speak to you in regards to, the risk factors and the necessary precautions that they may want to take. And so, like I mentioned before, your screening, your mammography screening could start as early as age 40. The average screening is from ages 50 to 75, in which the median age of breast cancer is that 55 for African American women and 61 for our white counterparts.
Yeah, I mean that's it's critically important. And so, one of the recommendations that I saw, Denise talking with Denise Baker, Syracuse Community Health Director of Quality Improvement, and also a nurse, is that if you're going for a mammogram, um, bring a friend with you. What do you think of that?
Um, I definitely agree. We should do this in pairs. I am an advocate that says that cancer doesn't happen to just the individual; it happens to the community and all the people that touch that one individual. So, mammograms are not the nicest screening tool that we have. It does you enter a machine, and it can be quite daunting to look at, and it pretty much smothers your breast between two metal plates so that they can get an accurate image of the fibers and the tissue within your breast. So it's important whenever we tackle any scary or scary tool or scary procedure that we include people that are close to us that can provide support. One of the responses when a survey was taken as to why women in in the African American community do not seek care is because it is scary. The unknown is scary. Having to get any biopsies or follow-ups can leave you feeling overwhelmed. So initiating and having someone to go with you is really to have it is in your best interest so that you can complete your screenings on a regular basis.
I know that you offer them. How people get a hold of you?
Oh, Syracuse Community Health, 315-476-7921. We will have a state-of-the-art mammography center in our new 930 building once we're open to the public. So we definitely will look forward to patients coming to see us.
Speaking of which, how close are you?
Oh, we're very close. We're very close. I can't give you a specific date quite yet, but we're very
It's
close.
very impressive. I think that I don't I know you had an open house earlier this summer, and just wow, it's just going to be really great for that
Mhm.
facility to be in the community. People have no idea how impressive it's going to be. It's not anything
Yeah.
like you can imagine.
Yes. The community deserves quality care, and we're here to provide that care for them.
What else should we know about breast cancer awareness, particularly for Black and Brown women and some of the things that they ought to do. You talked about diet, exercise, all of the things that lead to good health for most people, right? You know, whether it's
Right.
heart disease or things of that nature. I know that you talked about some myths, what might be fear that people have. Anything else we need to know to make sure that we get the message out to support women, and particularly Black women, since we know that they're 41% more likely to die because of because of the late diagnosis, among other things.
Um, uh, Definitely. I think that the key takeaway here is that early prevention, early screening is going to be the key to our success in preventing in finding and identifying breast cancer. The sooner, the earlier does not necessarily mean that it's not going to be bad, but the longer you wait, the more invasive it can go and outside of the breast, and that's where we run into trouble. So, really get your be familiar with your breast. Any changes, speak to your doctor in regards to it, and make sure that they're listening to you and that you're heard. If you're not feeling that you're heard, then please, by all means, come to the Syracuse Community Health. We hear you. We want to support you, and get your mammograms screened regularly.
October is Breast Cancer Awareness Month. If you haven't been screened this year, it's a good time to get screened right now, and bring a friend. Tell a friend, tell a friend. Y'all should have let's have a mammography party, right? A mammography party, and bring folks together, and
Absolutely.
everybody.
You should see the front foyer of 819 South Salina. It is full of breast cancer screening information. Actually, any woman who is receiving their mammogram at our facility will receive a small little packet. Our radiologist created these little giveaway packets to help women feel secure. So come on down.
All right, and you talked about the last thing I want to say. Have you made improvements so that the exam is more comfortable? You know, are the plates heated or anything like that? I don't know. I'm just wondering. I'm asking for friends.
Well, and you bring up a good point because the other piece of that I should make sure I mention is that breast cancer does not happen just to women, right? One in 833 men will have a diagnosis of breast cancer. So men making sure that they check for lumps and bumps, it can happen to our brothers out there as well. So um, not identifying an issue before it becomes dire is really what's impacting us. So is there anything that makes it more comfortable? The test is what the test is, and the screening is what the screening is.
Okay.
But if you can have someone, right, come with you or support you in that manner, and we have staff here that will welcome you with open arms and help you navigate it. Education is key. Um, Definitely feel free to stop by and we can walk you through it and make it less scary, less daunting, because sometimes you have to show up for yourself in order to make sure that you put yourself first and get the care that you need. Self-care is important.
All right, Denise Baker, Director of Quality Improvement, Syracuse Community Health, a nurse here to help us get the support that we need. Call the Community Health Center at 315-476-7921, SyracuseCommunityHealth.org, and healthy happens there. Inspiration for the nation.